You do need to wear your student scrubs. There have been times in the past where we wore just street clothes, but you need to wear your student scrubs. You need to have your name badge. It's especially important at having it, and it's important on any unit, but it's especially important here. So I would have to send you home if you don't have your name badge. The only thing that I ask you do is take a piece of duct tape or masking tape, cover up your last name on there. Because although our mental health patients are not dangerous, they are very friendly and they will try to find you occasionally afterward if they really like you as a student. So just cover your last name, yeah. I know when I worked mental health, our name tags had only our first name on it for that reason. So make sure you cover that up. And you need to be a little early, if at least, 6:25, because it's a locked unit and I have to go through a lot of doors. So if I don't get you in through all these doors on time, we'll miss report. So I need you there by 6:25. That works, works really well. By the time we get in and everybody puts their stuff away, we'll be on the unit by 20 of 7, which is when they start their report. Okay. Do's. No, let's start with don'ts. Don't give any of your personal information to a patient, name, address, phone number, If they ask about, yeah, I'm married, I have 2 kids, whatever, but don't give them a lot of details for a lot of different reasons. And you are not to go into any patient's room, their personal room, unless you're with a doctor, a therapist, a unit nurse, or me. Just stay out of patient rooms. They're required to keep their doors open, but some of the rooms are down side hallways away from the common area. So we just don't want you in a patient's room. Don't take anything onto the unit other than I gave you a sample mental health assessment form. I don't need you to fill it out, turn it in. It's just things that you look for in a mental health assessment. If you want to fold that up, stick it in your pocket. There are pencils and things on the unit, but we can't take anything on the unit because they have a count of what's there and they have to keep track. So, let's see, what else? What else do I have on there? Don't take any sharp objects, which means, pens, pencils, scissors. Nothing with strings unless it's your shoelaces. Shoelaces are going to tie. But if you've got, a jacket that has a string or something, you can't take strings on the unit. Why? Why would you not want to take strings on the unit?
Because they can hurt you with them.
Yeah, they can strangle themselves with it. Do what?
Strings in your pants.
No, that'll be okay as long as I think they're mostly thinking of hoodies or, I've seen some scrub jackets that have the strings in the top, so.
How about like your stethoscope?
No, nothing, no stethoscopes. You'll notice that the unit nurses do not wear stethoscopes around their neck on the behavioral health unit for that very reason. I've had a patient grab mine and just, it's easy to get a hold of it. I don't even wear mine around my neck on a med surg floor anymore. I'm a little paranoid. But no stethoscopes, because we won't be doing that kind of assessment. If the CNAs are behind, we'll help them take morning vitals, but they have all this stuff right there. So, don't bring anything onto the unit. Obviously no phones on the unit for pictures and HIPAA. Do bring only your necessities. Since they revamped the unit, since I was there in the spring, they have totally gutted the inside and put things in lots of different places. They now have visitors hours midday, and all visitors have to put their things in the lockers. So we're limited to about 4 little lockers, 12 by 12. So don't bring, heavy coats. There's no place to put coats. Leave your coat in the car. If you want to bring a lunch, you may do so, but we don't have a refrigerator to put it in. You'll have to put it in a little ice thing, because we will go to lunch at the cafeteria. But for those that want to bring their own lunch, it's fine. We'll just have to stick it in a cubby somewhere. Because you guys are going to be there just one time, and I have 7 or 8 of you, I got permission at the hospital to have you guys park on the ground level parking lot. Like if you're coming into the hospital, you turn right in there by where the Heart and Vascular Center is, and to your left you'll see a big white sign that says Behavioral Health Unit. Just go in that door. That's right into the lobby. Because if you have to park in the parking garage, I don't know the hospital well enough to get you through there. So I did get permission for you guys to park on that flat spot right on the main parking lot. So go ahead and park there. I gave you a handout with some terminology and some abbreviations. Like I said, I don't need them for myself, but when you listen to report, mental health abbreviations and terminology is different than other floors. So if, you're getting report and they say, well, my patient is AH and VH and SH, and well, they have auditory hallucinations, visual hallucinations, and sensory hallucinations. Do they have homicidal ideation, or it'd be just written as HI. So those are different. So I gave you, just for you to go over and look at, get familiar with ahead of time. You can bring them and stick them in the locker, but I don't think you'll really need them, because I can usually interpret most of them for you, but it gives you an idea of some of the terminology that they use that's different, and it will let you know when you're listening to report what to listen for your patient, so that you know what to watch for and what to glean for your IPR, okay? Let me see. When you go in, most of my groups I think have 7 or 8 students. They will have already picked patients for us, because they ask the patients, would you like to have a student, or would you be okay with a student? So the patient you're assigned to has already agreed to have a student. So it's, if they don't want a student, don't want you around, they won't choose those patients. So you would go in and introduce yourself to your patient and sit and talk with them. Gather the information that Ms. Marshall has given you for your, that you need for your IPR. We'll participate in group. They have large group sessions. There's a morning session where they all get together. Each patient has to give just one blank. Oh, their goal for today. They have to give a goal for today, how they plan to meet that goal. And if we're sitting in the circle, we just give them a goal for today too. And it might mean that my goal for today is just to learn a little bit more about mental health. It doesn't really matter. And then they also have activity groups that we'll probably participate in. There is an art therapy group where they draw, and there's one of the rooms, I'm not sure if it's still there, I'm hoping it is when we get there. I went onto the unit the other day, but I didn't see it, that they decorated ceiling panels. And if you look at them, they tell a lot about their emotions. It's really pretty cool. We have pet therapy. We have, which is one of my favorite times, there's 4 or 5 dogs that come in. One guy has a massive lop rabbit, but it's really cool. And it's amazing to me how the animals will figure out which one of the patients is really having a bad day, and they'll just go. It's just really cool. So we also have music therapy. The Shenandoah University music therapy students come over and do therapy group, which is always a lot of fun. They have bongos and stuff, and the patients get involved in that too. So you'll have one-on-one time with your patient. There is a possibility of making rounds with either Dr. Nardelli, Dr. Shake, or Dr. Ball. He's the head of the unit. They all love having students. Dr. Ball will talk your arm off, given the amount of time. He also is the one in charge of ECTs. And there may be an opportunity, I talked to Tammy day before yesterday, about taking a few students in maybe to see an ECT, an electroconvulsive therapy. It's not like the Frankenstein monster thing, like people get that idea, but it's the concept of an ECT is that it resets. It's like rebooting your computer, because your system works on an electric system. Your body works on an electric system, and it kind of reboots things, and it's really effective for depressed patients. Excuse me. So we may get a chance to do that, a couple at a time. They're now doing more than ever, because they're now doing all the outpatient ones too. So that's kind of our breakdown of our day. We'll get there, we'll get report, we'll go into group. You'll have one-on-one time with your patient. There are things on the unit, puzzles, coloring books, and sometimes it's real easy if there's a couple of them working on a puzzle. You just sit down, you just start talking and putting a puzzle together. It's kind of a little distraction. You're not right in their face, Same way with coloring pictures or art therapy. So we'll be able to do all of that. And then afterwards, we're gonna have a post-conference and, talk about what you've learned. And, so would questions on, I know it's hard to ask questions when you've not been there, but.
Are they just like adults, or are there kids up there too?
No, both of our units at behavioral health have to be 18 and older. There are 2 units that will be on. There's one it's called geriatric psych, and then there's one adult psych. I was telling Miss Marshall yesterday, that was the first time I've been on the geriatric unit, they start geriatrics at age 55. It's like, okay, just give me a bed, we're fine. But they don't take dementia patients. So they're patients that are over there. There are 2 manic depressives over there. There's one multiple personality lady over there right now. Very interesting. When you talk with her, she's a little girl. And she was also a professor of physics years and years ago. So, and she's this little child. And if you start asking her questions, you know, physics or anything like that, she becomes the professor. It's just fascinating to watch her. You know, and then when you're gone and she's back to she's coloring again. She's the little girl. So she's a multiple personality. She's in and out quite a bit. She's on
she
the
was really a professor?
Yes, she was. She really was. She was a. Yeah, we're saving a bed for Miss Marshall when she gets here. So, no, yeah, she really was a physics professor. And the amount of physics I know, I learned from the Big Bang Theory, so I'm not really good at asking questions. But if you start asking her about classroom stuff, her personality changes. She's on the geriatric, so if I end up putting a couple of you over there, it is not dementia, it's not Alzheimer's. We have multiple personalities and bipolars and a couple of schizophrenics over there right now. So, yes, ma'am. Ooh, most of the time, each nurse has 8 patients. It's different than a med-surg floor though, because you're not busy changing dressings and doing IVs. It's a lot of supervisory. They come to you for their medications. Medications are kept inside the nurse's station. So they come and find you. So it's a bigger ratio. But they also have the specific, our CNAs that are on that unit are psych tech CNAs. They're trained for that. So
what if they don't come to you to get their medicine? You have to go.
You have to go find them. Yeah, you'll go look them up. But they don't bring the medicine carts. There's one nurse that brings a medicine cart on the floor. It scares me to death, but others don't. They stay in the window. So, any other questions? No? Nothing amazing? Okay. It's really fun. It really is a good experience. You know, I take students on the unit and they hear the door lock and then you get that deer in the headlights look. You know, like, oh, I'm stuck in here with these crazy people. But we do have recovering addicts and alcoholics in there also. The youngest, like I say, is 18, but it's amazing how many 18-year-old heroin addicts we've had come through there. It's really sad.
How long do most of them stay up there?
About a month, a little bit longer if they have a temporary detaining order and the court orders them. They'll stay there. Our census goes way up in the wintertime because they know just exactly what to say to get themselves admitted to the unit, and then they've got 3 or 4 weeks of a warm bed and food, and they know how to play the game. But they end up doing just what Miss Marshall was saying as far as the fact they can't afford their meds. So they're in with us, they get their meds, they get stable, they go back into the community, have any money, don't take their meds, and they come back to us. So it's a sad revolving door situation. So, all right, I will have you, if you have no more questions. Yes, ma'am.
What paperwork do you need us to bring again?
I need you to bring your evaluation, because I only have you 1 day, so you better be amazing on that 1 day, because otherwise, yeah, just the evaluation for your 200 class. Because I will do them and give them back to you. We'll go over them in post-conference.
And she and Ms. Starr each will let y'all know when to turn in your IPR.
Right.
You turn your IPR
We'll go to
into
me.
her or Ms. Starr, not me. That's the only one you don't turn into me.
Yeah, we're grading them. So, and my rule of thumb is, it depends on what day you're there. But I usually do a week. I give you a week at the most. You know, usually I give 7 days. So, you know, if you're there on a Tuesday, it'll be due the next Tuesday by midnight. Is what I normally do. So I'll give you time to work on it.
How will we get it to you?
Pardon me?
How will we get it to you if we won't see it again?
Just email it to me. Just email it to me. My phone number and my email address is on the bottom of that clinical sheet. If you're stuck, I don't mind an email saying, hey, I don't really know what to put in here, or, you know, I'm confused about this section, just send me an email. I'll answer you real quick. So. All right, if that's everybody's scared to death or everybody's comfortable. It's like nobody's saying anything. Would you do the survey for me?